All the chores, let it go.
Hey there, welcome to eM-Dayspring. I'm Dr. Matt. Again, I'm coming from the office here on the weekend, so Allison is off, but I'm here to tell you a little bit about the OB module Reboot. We are actually going live today, as it turns out, and we needed to get some videos out to show you guys some of the changes. The improvements on the OB module are significant, and workflow-wise, there's just a few changes you need to be aware of as we get started here. Episode 2A dealt with the lab, so episode 2B is going to deal with nursing. And let's go ahead and get started, take a look and see what's going on with that. So as you guys come up to tracking board, you'll see a familiar face here. Minnie Mouse is in the waiting room. She has already been to the lab and is back in the waiting room, and so she's all ready for a nursing visit. And so you're going to left click and place her in a room, and we'll select room 1. And of course, as you normally would, you're going to left click and select Collect Vitals Visit Note. One of the things you're going to notice right off the hand is that even if you come to visit HS, there's no flow sheet. You can see a flow sheet listed here, but it's not going to be the main driving piece of the OB module anymore. The visit note is going to be the main driving piece, and there's going to be a flow sheet that's actually embedded in the note, which should make this run significantly smoother, make it easier for you, and should decrease the number of lockups that we've noticed in the past. And so you're going to want to go ahead and select the white note to create a new note, just like you normally would. But once the patient is pregnant, you're going to notice there's actually 2 new selections on here. There's an OB doctor's visit and there's an OB nurse's visit. Both of these visits allows the flow sheet to be dropped directly into the note. And so for an OB doctor's visit, you're going to want to select this one. Again, you'll see the normal intake information that you're going to update and make sure is correct, make sure your provider is correct, make sure you're listed as the assistant, and make sure that it's an office and outpatient visit just as you normally would, and make sure your location is correct. And once all that's done, you're going to hit save, and you're going to open up the OB note. Now, the first difference that you notice right away is that the flow sheet is no longer in a separate tab. It's actually right here on top of the note. Now, you're only going to be able to see about 3 or 4 lines. You can scroll up and down if you want to, but you're only going to be able to see 2 or 3 lines right off the bat. If you want to see the whole flow sheet, and you go to select the OB module tab and select the visit flow sheets, and you'll be able to see every single flow item that's available, although in this patient there's only a few. To get back to the note, you come over to last visit and select that tab right there. Now, the next thing that you're going to do, and probably the most important thing that you need to realize, is that to drop the lab's information that they have already entered into the Vitals module into the note, you're going to need to come over here to Vitals, left click on that tab, and add existing vitals. What this does is this drops the urine results that the lab has already recorded in the Vitals module. This is extremely important that you do this before you start entering your own vitals, because once you enter your own vitals, you're not going to be able to import the lab's values in. And so the very first thing that you're going to do each and every time after you've created a note is to go ahead and drop the existing vitals into the note. And I can't stress how important that is. And last thing we want is old vital signs left in the existing vitals memory, which could get confused later on. And so make sure the very first thing you do is drop the vital signs, the existing vital signs, into the note. The next step that you'll then go ahead and do is finish out the flow sheet. You can access the flow sheet 2 ways now. You can actually come up here to the little pencil and click on that. What you notice is instead of editing the information in the flow sheet itself, you have a very convenient and well-marked window box that opens up that allows you to enter the information that you need. For example, the fetal heart rate, and we're going to enter that at 126 today. You can also ask you can go ahead and record the blood pressure, and she's going to be 130/67 today. And you can put left arm and standing. And then finally, you can enter the patient's weight. We're going to say that maybe today she is 132, so she's lost a little weight since the last visit. If you notice, the lab's information, since you put drop the existing vitals into this note, the lab information is already there and does not need to be re-entered. Once you've got all your information in there, you can hit save and go on. So you say, what if I need to put in, say, a pulse, or what if I need to put in a pulse ox or a temperature? Well, the way that you would do that is to access the vitals in the other way, which is come over to this vitals tab right here and left click on the arrow and come down and select edit vitals. That actually brings up the entire vitals module, and so you can enter general information. If you notice, the patient's blood pressure, which you put in here previously, is already recorded here. And if you decide, no, I really only need to put OB information in, then you click on the OB module, and sure enough, here's all your information, including the weight you previously entered, the fetal heart rate you previously entered. It has the gestational age up here in case you want to take a look and see where they are with that. And again, it has the lab's information already here because you dropped the existing vitals into the note. But I can come over here and I can say, well, I really need to get a temperature today because she's not feeling well. And her temperature is, say, 99.9. And we'll hit save. Notice that the temperature doesn't appear in the flow sheet, but it does appear down here in the note right here, just as you would expect that it would. All right. Now from here on out, the visit is pretty much the same as you normally would have. You come up to Chief Complaint, and you go ahead and find our template, and you select that it's an established patient, that this is a subsequent pregnancy for her, but that it's a routine check. You come down here and you do any transitions of care and any specialist visit. Well, yes, she has. She saw High Rock last week, and so I'm going to type that in here. And then finally, as usual, you select the health maintenance counseling, and then you click off, and of course that takes care of the chief complaint. The next step would be then to add your questions that you ask under the OB flow sheet, under the OB HPI rather, and you left click on that. She's in the first trimester still, or actually no, I guess she's in the last trimester, so we're going to select third trimester template, and we're going to select on that and type in 38 6/7 for the gestational age, and then we're going to ask overall status. Well, she's doing well, not having any problems today. She is taking her prenatal vitamins. There's good fetal movement. And as far as symptoms are concerned, she really doesn't have any symptoms at this time. It is doing quite well. And then you can click over on the white space here, and that corrects all that information. And then finally, as you would scroll down to here and do any preventative health counseling. Most notably, for our sake, we can note that her vaccines are up to date, but if she needs depression screen or substance abuse screen or SBIRT screening, you'd want to provide those as appropriate. But we're going to check that she's up to date today. Very good. And as typical then, once you've completed your section of the note, you would actually go ahead and key out again and left click and mark ready for provider. And that is the OB visit in the new OB module. Again, most important change, and I can't emphasize this enough, is to make sure once you create a note, the very next thing that you do is you drop existing vital signs into the note. But after that, the visit is entirely the same, and you're able to carry on without any difficulty. So if you guys have any questions, you let me know. Other than that, carry on and keep up the good work. See you next episode.
There's an albatross around your neck. All the things you've said and the things you've done, can you carry it with no regrets? Can you stand the person you've been?